Assalamu alaikum. My name is Humaira Ansari and my roll number is BP1650085 and the drug which was given to me is chlorhexidine. First we have to see what are the major indication of chlorhexidine. Chlorhexidine belongs to the class of drug known as antimicrobials and water-based formulation of chlorhexidine is used as an antiseptic because it is active against vegetative bacteria and has variable activity against fungi and viruses. Basically, chlorhexidine is indicated in wounds, burns, fissures, and cervical erosions, and also indicated for the gum diseases like gingivitis because it has antimicrobial activity. In an alcoholic solution, it is useful skin disinfectant, but it is not recommended for household use because of its selective action and cost. Chlorhexidine oral rinse is also indicated in the patient who are undergoing the chemotherapy because it reduces the severity and frequency of mucositis infection by eliminating the microorganism in oral cavity. Now we see what are the major side effects associated with chlorhexidine, as chlorhexidine is used on the skin and also used for oral diseases. So the side effects are also associated with these two sides. But chlorhexidine has very low skin sensitizing or irritating capacity. Also the oral toxicity is also low because it is poorly absorbed from the alimentary tract, and chlorhexidine must not be used during surgery on the middle ear because it causes sensorineural deafness. And the most common side effects which are associated with chlorhexidine gluconate oral rinse is the staining of the teeth and other oral surfaces, or an increase in the callus formation, and it also causes the alteration in taste perception. These are all the side effects associated with chlorhexidine. Now we see what are the major drug-drug interactions. According to one of the study, chlorhexidine is not compatible with sodium lauryl sulfate. And sodium lauryl sulfate is widely used in most of the toothpaste. And it is concluded that a 30 minutes interval between the sodium lauryl sulfate and chlorhexidine rinse give a significant reduced anti-plaque effect of the chlorhexidine. मीन्स अगर हम सोडियम लोराइल सल्फेट और क्लोरहेक्सिडीन को साथ यूज़ करेंगे तो वो एंटी प्लाक एक्टिविटी जो क्लोरहेक्सिडीन की है उसको सिग्निफिकेंटली रिड्यूस कर देगा. और जो दूसरा ड्रग ड्रग इंटरेक्शन है क्लोरहेक्सिडीन के साथ वो एक एंटीबायोटिक ड्रग है जो कि नेस्टैटिन है और वो वाइडली रिकमेंड की जाती है अगेंस्ट द ओरल कैंडिडियासिस. और इट वाज फाउंड दैट द minimum inhibitory concentration value of the combined drug, that is nystatin और chlorhexidine, यानी ये दोनों ड्रग जब एक साथ दी जाएंगी तो जो मिनिमम इनहिबिटरी कंसंट्रेशन है वो बहुत ज़्यादा इंक्रीज हो जाएगा, अप्रॉक्सीमेटली 33 times the minimum inhibitory concentration value for the nystatin solution and 4 times the value of chlorhexidine gluconate. और जो इसका रीज़न है, what is the reason of this drug-drug interaction is that a low solubility chlorhexidine nystatin salt is formed, thus rendering the combined drug complex ineffective as an antibiotic agent. यानी कि उसकी जो solubility है, जब दोनों combine होते हैं तो जो solubility है वो low हो जाती है, जिसकी वजह से जो उनका एंटीबायोटिक एजेंट इफेक्ट है वो भी रिड्यूस हो जाता है. इसकी वजह से मिनिमम इनहिबिटरी जो उनकी कंसंट्रेशन है वो इंक्रीज हो जाती है. डोज वेरिएशन एंड पॉपुलेशन, यानी क्लोरहेक्सिडीन को हम एडल्ट्स के अंदर किस डोज में दे सकते हैं और पीडियाट्रिक्स में किस डोज में देते हैं. नाउ द यूजुअल डोज फॉर एडल्ट्स for gingivitis 15 ml approximately 0.5 ounce in the mouth undiluted for 30 seconds and then spit out and use 2 times a day. For periodontitis 2.5 milligram, one periodontal chip inserted into the periodontal pocket with probing, and the pocket depth should be 5 millimeter or more every 3 months. For skin disinfection, it is used as chlorhexidine gluconate 2% or 0.75% topical solution. Then the usual pediatric dose for skin disinfection and preoperative. For 2 months and older, Chlorhexidine gluconate 2% or 0.75% topical solution is given, and for 16 years and older, chlorhexidine gluconate 92 milligram topical dressing is given. The alternative choice of chlorhexidine. What are the alternative choices when someone has allergy to chlorhexidine? Then the alternative choices are povidone iodine, alcohol, benzalkonium chlorides are used when someone has any allergy to chlorhexidine. Also, because of the side effects of the chlorhexidine, some dentists has developed the alternative, which is chlorine dioxide gas, and it has the same action as that of the chlorhexidine. Also is removed easily and quickly without lingering the side effect. Because of these features, it make it safe for everyday use. In addition, activated chlorine dioxide has been shown to effectively remove biofilm, neutralizing volatile sulfur compound, and kill fungi and viruses. Now let's see what are the maximum and minimum prescribing dose for chlorhexidine. The maximum dose of chlorhexidine dichloroquinate is 4% solution, which is used for surgical site infection prevention. And the minimum dose of chlorhexidine gluconate is the oral rinse, which is prescribed in a percentage of 0.12% twice daily. What are the brand names with the highest and the lowest price? Chlorhexidine is the brand which is by PharmaWise, and it is a solution of 1.5%. It has the highest price of 380 rupees. Then the second brand is Chloro4, which is by MediSearch, and it is present in the solution form of 4% 500 ml, and its price is 300 rupees. Now the third brand which has the lowest price is Parapol by Lisco, and it is the suspension 120 mg for 5 ml, and its price is 16 rupees, and it is the lowest price of brands of chlorhexidine. The available dosage form for chlorhexidine. The available dosage form for chlorhexidine includes solution, liquid mouthwashes, insert of extended release swab, and sponges. Solution in a concentration of 0.02% and 0.05% solution is preferred in the condition of bladder irrigation and wound disinfection, because in these conditions we do not need the higher concentration of chlorhexidine. That's why solution is preferred. Then the liquid mouthwash, chlorhexidine 0.12% oral rinse USP. It is used for the oral infections, that is gingivitis and mucositis. In these conditions, we use the mouthwash. And insert extended release, that is the perioject. It is used for periodontitis, because for periodontitis we need the concentration to be maintained. That's why we use the extended release dosage form. And swab, antiseptic cleaning wipes are used in the condition, that is antiseptic cleaning of the desired area. Desired area को clean करने के लिए हम chlorhexidine के swab use कर सकते हैं. And sponges, which are the Becto shield for surgical hand scrub, it's used in this condition. Rational use of chlorhexidine. Chlorhexidine, as I said, is a disinfectant and antiseptic, and it is used for a skin disinfection before surgery to sterilize the surgical instrument. It is used for both, that is for disinfect the skin of the patient and the hands of the healthcare providers too. It is also used for cleaning the wound, preventing a dental plaque, and treating the yeast infection of the mouth. Irrational use of chlorhexidine. The cases of irrational use of chlorhexidine in the medical practice was found in Ukraine, and the consequence of such cases includes the failure to achieve the therapeutic goal and to develop the nosocomial infection, as well as the selection of chlorhexidine resistant strain of microorganism. Also, FDA, that is the US Food and Drug Administration, also warned us about the allergic reaction which was reported for the chlorhexidine use. That's why the healthcare professional should always ask the patient if they have ever been allergic reaction to any antiseptic before recommending the chlorhexidine gluconate products in order to avoid the irrational use of chlorhexidine. हाउएवर अगर क्लोरहेक्सिडीन जो है 4 वीक्स ज़्यादा यूज़ होगा तो वो टूथ स्टेनिंग कॉज करेगा और चौकी बिल्डअप चौकी डिपोजिशन भी करेगा टीथ को, जो कि कैलस होता है. टॉक्सिसिटी एंड एंटीडोट ऑफ क्लोरहेक्सिडीन. The LD50 of chlorhexidine, which was administered to a mice, is more than 5 gram per kg. But small childs are more susceptible to chlorhexidine overdose or toxicity. That is, the ingestion of 1 to 2 ounce by a small child may result in gastric distress, nausea and intoxication. अगर क्लोरहेक्सिडीन की 1 से 2 आउंस तक चाइल्ड इंजेस्ट कर लेता है तो उसको गैस्ट्रिक डिस्ट्रेस, नोजिया और इंटॉक्सिकेशन होगी. और ट्रीटमेंट जो है उसकी जो टॉक्सिसिटी की जो ट्रीटमेंट है वो सिम्टोमेटिक होगी, यानी सिम्टम्स को रिजॉल्व करेंगे एंड सपोर्टिव मेजर्स. Seek medical attention if child ingested more than 4 ounces of chlorhexidine solution or if symptoms of intoxication develop post exposure. One of the studies suggests that if an adult accidentally swallowed the 20% chlorhexidine solution, which is equal to the 100 dose of the standard to 0.2% chlorhexidine, यानी कि जो स्टैंडर्ड डोज है माउथ वॉश की क्लोरहेक्सिडीन के वो 0.2% स्ट्रेंथ है. अगर कोई 20% क्लोरहेक्सिडीन की शॉट ले लेता है तो उसकी जो इमरजेंसी ट्रीटमेंट होगी वो उसमें इंक्लूड होगा वॉशिंग द ओरल कैविटी विद 30 ग्राम ऑफ द टूथपेस्ट, ड्रिंकिंग 100 ml ऑफ 5% alginate syrup and ingestion of 5 gram of coke. These are the toxicities related with chlorhexidine. Now take the case study. As I have told you that chlorhexidine is used as an antiseptic for peritonitis in the patient who are undergoing the peritoneal diuresis. But chlorhexidine is widely used, or it is widely considered as first drug of choice for gingivitis, a gum disease that causes the redness and swelling of the gingiva. That's why I have taken the case study of gingivitis. Here is the case study. Miss Patricia Jirena is 36-year-old and has normal blood pressure, that is 120 by 80 mm of Hg. Her weight is 67 kg and the only medication she is taking are the birth control pill. She came to the dentist and complains about bleeding when she brushes her teeth and feels that her gums are very tender and painful. Her oral examination shows that her gingiva is red around the margin, swollen, and upon touching it bleeds easily. Some X-ray and radiographs are done. When the area is probed with periodontal probe, there is usually no evidence of bone loss. The diagram of radiogram shows a probe inserted into a sulcus around a premolar. It measures about 4 mm. Each back and silver band represent 3 mm increment. 3 mm is a normal reading for this area. But because the margin gingiva is erythemic and edematous, the reading has increased by about 1 mm. The lack of the bone loss can be confirmed when reviewing the radiographic images. She is bleeding this bleeding problem since 3 months and did not seek any of the medical advice at that time, and she has no allergies. Now the soap notes. First, subjective. The chief complaint: patient is complaining of bleeding from gums at the time of the brushing and feel tenderness in her gums. The age is 36-year-old, gender is female. History of illness is that she experienced this bleeding problem since 3 months but did not seek any medical advice at that time. Onset of the chief complaint is that she has pain and bleeding from the gum at the time of brushing. Now the medical history of patient. She does not have any other medical condition except that of poor oral hygiene, And the current medication and allergies are that she is taking the birth control pill and the patient has no allergies. Now the objectives. First we see the vital signs. Blood pressure is 120 by 80 millimeter of Hg, which is normal, and the weight is 67 kg. Laboratory data includes the radiographic images of the gums, reveals that there is no evidence of the bone loss. Examination of gums, there is a redness and inflammation. जो पेशेंट का ओरल एग्जामिनेशन हुआ है फिजिकल, उसमें ये आया है कि इसको जो पेशेंट के गम्स हैं वो रेड हुए हुए हैं, स्वेलन हुए हुए हैं और इन्फ्लेमेशन है यहाँ पर। और जो रेडियोग्राफिक इमेजेस हैं उससे ये रिवील हो गया है कि ये जो भी कंडीशन है इसकी वजह से बोन लॉस नहीं हुई है माउथ की। Assessment. Usually the gingivitis is assessed by the examination of your teeth, gums, mouth and tongue for the sign of plaque and inflammation, and also it is assessed by measuring the pocket depth of the groove between the gums and your teeth by inserting a dental probe beside your tooth beneath your gum line, usually at several sites throughout the mouth. The probe is inserted and then the gingiva is assessed or diagnose. As in this case, after looking at patient's health data and lab examination finding all indicate that she has gingivitis. That is all the symptoms that patient is experiencing, which are redness, swelling, bleeding and pain. All these indicate that she has initial state gingivitis. And gingivitis is the inflammation of gums caused by the buildup of bacterial colonies in the mouth. And additionally, as the patient is taking the birth control pill, so the changes in the hormone can also causes the gingivitis to worsen. The changes in the hormones, smoking, all these conditions can worsen the gingivitis. Now the plan. As gingivitis is caused by the bacteria and inflammation, and if we do not stop this bacteria and ongoing gum inflammation, it can cause the serious conditions like periodontitis, in which the pockets between the gums and teeth are developed and these pockets are filled with plaque, tar and bacteria. As gingivitis is mainly caused by the poor oral hygiene, then the ideal treatment is the meticulous oral hygiene. The oral hygiene is usually obtained by brushing twice daily and cleaning the mouth with oral rinse. As in this case, the patient is adult, so chlorhexidine gluconate in a percentage of 0.2% oral rinse, 15 ml as a mouthwash for 30 seconds 2 times a day is prescribed to her because this reduces the number of active bacteria and in the mouth and dilutes the quantity of biofilm. Also, there are several studies which shows that there is a greater inhibitory effect when we give combination of chlorhexidine oral rinse with fluoride based toothpaste. So we also prescribe the fluoride based toothpaste in this condition. Now we have to do the patient counseling. We need to advise the patient to maintain the proper oral hygiene and use the chlorhexidine oral rinse after brushing the teeth, and rinse the toothpaste completely from the mouth and do not eat for several hours after using the chlorhexidine rinse, and switch the chlorhexidine oral rinse around in the mouth for 30 seconds and then spit out. Use the full strength of the chlorhexidine oral rinse and do not dilute it. These are the references from which I have taken the case study and other related material. Thank you.